Thanks so much. I'm really so happy to be with you. I just came back from the funeral of John Lewis. It was amazing. But one of the things that really came through about John Lewis and his life, his early achievements, he had no pin that said he was a member of Congress. There it is. Mm-hmm. He had no particular authority. He made a decision that he was going to stand up and do the right thing because it was important for our country, for our democracy. And I want to tell you, I started out as an organizer and advocate. And in fact, in the 80s, I was the director of the State Council of Senior Citizens, the chapter in Illinois of the National Council of Senior Citizens. And at that time, some of the members, some of the leaders were actually present when the President of the United States in 1965 signed the Medicare and Medicaid Act. I mean, it was pretty amazing, that accomplishment. But since I've been here, we have seen, at least since it seems like forever, but it hasn't been because I was here when we passed the Affordable Care Act. But ever since Donald Trump took over, what we've seen is a diminution of health care. I can't even really understand why he is pursuing a lawsuit that would completely overturn the Affordable Care Act, Obamacare. By the way, Obama spoke beautifully at John Lewis's funeral today. There were 3 presidents there, Clinton and Bush and Barack Obama. But also to try and take away the advances that we've made. It's amazing to me that there are still states that are not expanding Medicaid coverage, 14 states. Mm-hmm. And the Kaiser Family Foundation estimated that an additional 4.4 million people would have health care right now if they had just expanded it. And let's remember, when Medicaid was expanded, it was 100% paid for by the federal government, and still the match is very big for states. In fact, in Illinois, our Illinois Medicaid expansion meant that from 29% lack of insurance in small towns and rural areas, it went down to 12% uninsurance just because they had more Medicaid. One of the most successful programs of the Lyndon Johnson era was Medicaid and Medicare. So the point I want to make to you, organizers and activists, is this really is about you. And we're your partners here in Congress. But it takes this kind of mass movement. It is no accident that we passed the Justice in Policing Act, was never on the agenda, But because people actually took to the streets, had actions in cities large and small all across this country, suddenly it came on the agenda. Organizing works, protesting works, advocating works. And that's exactly what we need right now. We are, of course, seeing every which way. We passed the ACA Enhancement Act, which is a fantastic bill that creates more opportunities for people to get health care, improves on the ACA. It is sitting on the desk in the Senate of Mitch McConnell, not calling that bill that would do so much to help so many. We have seen a dramatic increase in the number of people who are on Medicaid, thank God, since the coronavirus and since they have lost their jobs and often lost their health insurance. It is for children. And by the way, the big expansion that we've seen right now, half of it is is made up of children. And this has been such a lifesaver for so many people. And so let us work together. Let us insist that as a right in the richest country in the world, that people deserve to have health care. This should not be a question. This should not be, and I'll tell you, some of my colleagues demean people that are on Medicaid. And as I said, we're talking about children, we're talking about adults, we're talking about a bill that we had to expand how long women can stay on Medicaid after the birth of a child. In my state of Illinois, women of color are 6 times more likely to die in a pregnancy-related death than white women. We have so many issues, and Medicaid is the answer to so many. And there's one more, and that's seniors. Because much of the money for people in nursing homes right now, 70% of nursing homes are for profit, but 85% of the money comes from the federal government. We all have a stake in nursing homes. And a lot of that money is Medicaid. Medicaid is providing for previously middle-class seniors who are in nursing homes right now. It's a fabulous program. It is just one of the best, one of the gifts, one of the treasures, I should say, in our country. And it was advocacy that finally made it happen in the Lyndon Johnson administration, and we can do it again. So I'm optimistic that big changes are on the way, and in the meantime, we have to fight. We do. It's just true. We have to fight. But the good news is, when we fight, we win.